Hello, this is Dr. Gay from First Look MRI, and this is a 17-year-old female who had an ACL tear and a subsequent repair, and she has re-injured her knee playing soccer. And on this view, we're looking at her in profile. The kneecap is on the left here. This is the femur, the big thigh bone. This is the tibia down below, and the anterior cruciate ligament, or ACL, goes right through here. We should see a very large, dark band coming off the back of the femur here, coming down into the tibia down here. These little areas of darkness with a halo of bright. This is related to the anchor that held the ACL graft in place. And the ACL graft, we just don't see a nice normal graft. Again, it should be really dark and really thick, but instead we don't see the graft anymore. So this is a re-tear of the ACL graft. And on this view here, we can see a coronal projection. We see the medial side of the knee, the medial collateral ligament. We see the lateral side of the knee over here, and right in the middle, this is the medial condyle, lateral condyle. The scooped out area is called the intercondylar notch. We see a dark band here. This is called the posterior cruciate ligament. The PCL comes up here obliquely, looks normal, but the ACL, which should be right next to it, just has fluid where we should see the nice big thick ACL graft. So this is a completely torn ACL graft, sadly. Just one other finding here. And so this is a coronal view. Again, we see the medial meniscus, which is a nice little triangle. We see the medial collateral ligament. It has a thick outer area, the thick outer fibers, and then some thinner fibers along the inside called the intercapsular fibers. You can see how the meniscus comes out and just blends perfectly in with the joint capsule and medial collateral ligament. There's no gap. And on the medial side, the medial and then posterior, we should see a nice close approximation between the meniscus, the peripheral rim, and the joint capsule. But here on this view, this is the reference line. We can see the medial meniscus, a triangle here, looking in profile now. Here's the back, and here's the inner margin. This is the anterior horn in front. Looks like a mirror image. This is the posterior horn here. Well, behind the posterior horn, we should see the joint capsule coming down and coming really close to this meniscus. But in this case, we see the joint capsule is way out here. We see fluid tracking down in between the meniscus and the joint capsule. So this is a meniscocapsular junction tear that is torn and separated, and now fluid is able to insinuate back here into the space where it normally cannot. So this is a view right here. We see bright signal outlining the posterior horn, the capsular surface. So we say there's a tear with separation involving the posterior meniscocapsular junction. Now this is another patient for comparison. You can see that there is sometimes increased signal right here at the junction between the posterior horn, the meniscus, and the joint capsule. It's usually fairly thin, and on this view right here we see that there's this real close approximation. It looks like they come right together right there. So normally it'll be very thin and narrow and uniform. You usually see some little gray tissue, and as we come around the rim here, look how they come right together. Just a continuous band of darkness to the meniscus. I'll go to our patient who has the injury. In this patient, we can see that if we come around the gap, we see this fluid-filled cleft here in between. So this is a meniscocapsular junction tear with some separation, along with the unfortunate re-tear of the anterior cruciate ligament graft. Thank you very much.